Hey, good morning, everybody. This is Brittany with the Seniors Blue Book, and today we are live with the Gulfcoast Ketamine Center. So welcome, gentlemen. How are you this morning?
We are doing great, and we're glad to be here with you.
Oh, thank you so much. We've got on the left-hand side, we have Topher Lawton. So good morning, Topher.
Good morning, everybody. Hope everybody's having a good morning.
It's a great morning because, as we mentioned, we've got coffee or tea. So we're kicking it off right. And of course, we've got Dr. Reichbach on the right-hand side. So good morning and thanks for being here.
Same here. Glad to be here.
So I know a lot of people have heard your name, but I would love for you guys to kind of talk about your backgrounds a little bit and how, Gulfcoast Ketamine Center came to be. So I'll kind of hand it over to you guys to talk about yourselves for a moment and then kind of get into the mission behind Gulfcoast.
Sure. First of all, I'm a anesthesiologist by trade, living in New York up until about 5.5 years ago, and part of a big anesthesia group back there. And when I moved down to Florida, soon after became extremely interested in the use of ketamine, which is an anesthetic that's been around for over 60 years, being used off-label to treat certain intractable mood disorders such as major depression, treatment-resistant depression, anxiety disorders, PTSD, and such. And so started the Gulfcoast Ketamine Center 4.5 years ago with the intention of being able to provide these treatments for patients, as I just mentioned, with certain mood disorders where nothing else was really helping, medications and different types of therapy, in many instances, electroconvulsive therapy, magnetic therapy. And ketamine was shown to have a very, very good success rate in bringing patients good responses and improving functionality from that point of view, as well as certain neuropathic pain conditions, chronic pain conditions. About 1.5 years into our ketamine practice, which sort of took off pretty rapidly, Amendment 2 was passed here in Florida, which basically allowed for the use of medical cannabis for patients that qualified with certain conditions, among them cancer, Crohn's disease, multiple sclerosis, PTSD. And I thought that it was a perfect addition to the practice, with the philosophy being, providing alternatives for patients when other more conventional treatments weren't working. So I did what I had to do to be able to provide these qualifications or provide these certifications for patients that qualified to obtain a medical cannabis card. What I found surprising from the outset was the age of the patients that were looking to get cannabis cards. This was something that was really surprising to me. I would say probably 70% of our patients are over 60 years old, and some of them had experience with cannabis recreationally, but the great majority of them did not. And once we started doing this, it became evident that this was not like going to a doctor's office with high blood pressure and being told, I'd like you to take this medication, this many milligrams, this many times per day. This was more of trial and error. Everybody seemed to respond differently to different types of medical cannabis, depending on which dispensary they went to, which routes of administration, because there are a number of routes of administration. You don't have to just smoke it. And it was a little bit harrowing for a lot of patients, especially older patients who were used to more conventional, Western medicine, where you are told exactly what to do and this is how it works. And a lot of them became frustrated at the beginning and really didn't know how to titrate it to try to get a response, or they overdid it and they became got too much of a head high, and that kind of scared them away. But just kind of fast forwarding, we felt that we needed to bring somebody in that had a really strong knowledge of cannabis in the first place, but more specifically, was willing to become an unbiased expert on the different dispensaries, because there's new ones opening all the time, and specific products within these dispensaries. So, when patients go to the dispensary, they're getting kind of a biased view when they speak to the person that's working behind the counter, because they're trying to sell their products just like anything else. And they don't really have a good feel necessarily for medical conditions and comorbidities, other conditions that are going on with the patient. And so what I thought was important was to bring someone into our practice that could really be hands-on. He and I discuss the medical aspects of each patient, and then I give him an idea of what we're trying to help with, with all the other considerations, age and other medical problems. And Topher has a rapport with just about representatives from just about every dispensary. He knows about all the products that are coming out, new products, specific products, which may be more helpful from one dispensary for one specific patient and another patient with different needs. And so he has been a real asset for us as far as once patients, the big thing is, and big complaints with that. And we get a lot of patients coming from other practices where there was no guidance as to what to do. Once they got the card, they were basically on their own, and they just felt very frustrated. So I think what makes us unique as far as the cannabis practice is that we have someone that can call anytime if they're at the dispensary and they need some guidance or they need some help. He's always available, and we've gotten a lot of positive feedback on his addition to the practice from that point of view.
Absolutely.
Kind of
And
a
Topher,
sentence, but
feel free, Topher, to jump in and tell us a little bit about yourself. And I love this. It seems like a perfect match, what you and Dr. Reichbach do together.
It actually, it really is. And so a little bit about myself. My background is I have a degree in actually environmental science with a focus on botany. And that's actually my background. And how I got into doing this was actually a couple of years back. I had a really bad accident and took a long time to put myself back together. And medical cannabis was something that gave me my life back. And so I wasn't able to continue doing the things that I did. So I wanted to almost, all right, well, this helped me. Let me can share how it helped me and help people in the same type of place. And so, I knew Dr. Reichbach and I knew, Lolita, and it just, I started kind of helping. And the first time I actually went out with them and was helping was such a powerful experience of helping. And I was like, all right, I need to do this. Let's make this happen. Let's figure out how to do this. And it's such a rewarding experience. And I mean, it's been a long time since, when you get up in the morning, instead of feeling, oh, I got to go to work, it's like, I get to go to work and I get to help somebody get better. And it's been absolutely amazing. It's great. And one of the things that's unique is, I'm a cannabis patient as well. So I know the trials and tribulations that everybody has to go through, the frustrations going to dispensaries, not knowing what it is. They've got 50 products. What is this? What do I need to take? What is this? And it's so confusing even for somebody who's experienced with it. And so it really does fill that niche. And, and the questions that people ask are so, I've been there. I've had those questions. So now being able to share that experience and that with these people it's been great. And it really, it's truly rewarding, and it's been really helpful, at least I feel, for the patients. So, it's been wonderful.
That's incredible. I didn't know your story prior to now. So it's having somebody that, it's great to have a resource, right? But to have somebody that's actually been through it themselves and can navigate those waters and you felt their frustrations, you felt, what they're going through. So that's amazing. So I do want to ask if So let's say there's a client who comes, who wants to know more information. What's kind of the process? What does like a typical client process look like for you both?
Okay. Well, typically they'll reach out to us either, via phone, they'll call the office or shoot, contact us through our website. And, if they call on the phone, usually I'll talk to them, or if the doc's available, he'll talk to them and just kind of will explain how the process works, answer any questions. I mean, people ask, well, everything from do I have to smoke it? This, all of these questions. So get them feeling more comfortable with the process and how it works. Nope, you don't have to smoke it. There are so many different ways. It's not the stereotype that you think of anymore. And then if they want to move forward with the process, then we we'll get them set up with an appointment and go all the way through and guide them through the process. We'll even help them fill out their application for the state online. And then actually, so they don't get turned loose, the doc had a great idea. We actually make folders up for every patient that has information on all the dispensaries, their information packets, where they are, their hours, their discounts. So they get as much information as they possibly can.
How about on the ketamine side, the services that you offer there?
Sure. So most of the patients that we get inquiries from are patients who have been struggling for a long period of time. This is not generally their first step, their first stop. Many of the patients are referred by psychiatrists and other healthcare providers, mental health care providers, and many are self-referred. So patients who have been struggling to the point where their depression has, basically just completely destroyed their quality of life, their ability to function. Some patients that we hear from can't get out of bed in the morning. Proper hygiene is a struggle. It's been going on for a period of time. They've been on medications, and either the medications haven't worked for any sustained period of time, or patients don't tolerate side effects. They've been through, like I said, more invasive procedures to try to help, especially with depression, ECT therapy, electroconvulsive therapy, some of them. And ketamine works by a completely different mechanism of action. I liken it to more of a hardwire change in the brain. There are actual physical changes that occur in the brain when you administer ketamine, as opposed to trying to find a balance between certain neurotransmitters that has been kind of the philosophy of how to treat mood disorders for the last 20 or 30 years. Increased serotonin levels, increased norepinephrine, dopamine levels. Ketamine works by a different mechanism, and that's the reason why very often patients will have a positive response to ketamine when they haven't responded to other medications. So when they call, a lot of them have done a lot of research on it, and it's very easy to find information on ketamine, especially the last couple of years. If you Google ketamine for depression or chronic pain, you will get a lot of information. It is being used we are treating patients with it off-label. It is not specifically approved for treating depression at this point in time, or pain, for a number of reasons. It is approved as an anesthetic. It's been FDA approved for that for decades. So, 30 to 40% of medications that are prescribed nowadays are being prescribed off-label. So that really shouldn't come as a big shock or a big surprise to anybody that we're using it effectively in this manner. So yeah, the process is generally, it's a phone call. And I speak to everybody that calls, personally, and I'll take as long as I need to explain the process, what the expectations are, what's necessary to get started if they want to trial it. Ketamine in the doses that we're using to treat many of these mood disorders is relatively low when you compare it to what the dosage would be used as an anesthetic in the operating room or whatnot. unless somebody has a history of psychosis, or they're bipolar in a manic or hypomanic episode, or liver failure, to me, there's a very low threshold to try it on patients who are at the point where they're struggling making this phone call. Because if they're making the phone call to find out about this, they're most likely struggling, and a large number of the patients that we see are, have had or are having active suicidal ideations or suicidal thoughts. So these are really patients that are struggling. And my threshold to try ketamine on these patients is extremely low, because the downside is really not that far down, but the potential upside can be extraordinarily high and life-saving in a lot of instances. And so the patients that need us find us, and more they go back to their psychiatrists or their mental health care providers and say, they're educating their physicians or their doctors a lot of times, because many of them are not really fully aware of what the benefits, or that ketamine can be an option for these really difficult cases. And the patients will go back and say, hey, you really should consider this for your other patients, because it really helped me. And a lot of mental health care professionals are not really aware of that.
Absolutely. And I think one question, a good question somebody might ask is, is this a one-time treatment? Is it how many, I'm sure every person is unique, but what's kind of the average?
Sure. Absolutely. So the protocol that I generally follow is to do 6 initial treatments for mental health. For pain, it's a little bit different, but just focusing on the mental health part of it right now. What we've found is that some patients have a dramatic response after 1 infusion, and trying to find the right dose is often an important part of it. But the initial studies that were done, a number of years ago, they gave ketamine. They actually went back. They found these surgical patients who had surgery for whatever reason. They post-op them, a day or 2 after, said, oh, how's your hernia? Oh, it's healing well. Anything else you want to tell me? Well, yeah, my depression seems a little bit better. My mood seems better. I can't really explain it. Nothing else has changed. So some pretty smart guy went back and, make a long story short, reviewed all the records, the operating room records and the anesthesia records. And there was a commonality between a lot of these patients that were describing these benefits that they had after surgery. And the large majority of them had received ketamine during the, perioperative course. So not everybody receives ketamine during when they get surgery, but these particular patients did. So they went back and did a study, and they found a bunch of patients that fit criteria. They gave them some low-dose ketamine, and virtually 100% of them had relief of their depression or improvement, a positive response in their depressive symptoms for up to a week. So they decided, well, if a large number of patients had improvement with 1 infusion, let's try to give 2 infusions and see if we can get longer. And sort of between practitioners, there's really no specific protocol. A lot of this is just experience and seeing a lot of patients, and commonalities between patients, what other medications are they on, how long have they been struggling with the depression, is there trauma involved? There's a lot of variables. But for the most part, I came up with 6 infusions. 2 reasons. The first, to see, if we don't see a response after 4, 5, 6 infusions, 6 infusions seem to be the point where if you hadn't had a response, you're probably not going to respond to ketamine. Second, the patients that did respond seem to have the longest period of relief with 6 infusions. Giving, reassessing, and if somebody has not plateaued, if their mood is continuing to improve through 6 infusions, we take another look at it and say, hey, let's keep going and do another 1 or 2 infusions and see it from there. For the patients who have had a good response, and we've been through 6 infusions, we make an appointment for what we call a booster infusion in 1 month from that point. What it does is it forces a conversation after a month, because what happened at the beginning was patients would have a good response. I would say when things start to slide back, you need to call and we'll do a booster infusion. Time would pass, and then I would get a frantic phone call 3 months later saying I could not even call. I was just so desperate. I couldn't leave my bed. I couldn't, my family, I wasn't in touch with them. So leaving it up to the patient completely didn't seem like the best move. So we decided we're going to schedule something in a month. You will have to call to cancel that appointment. So it'll force a conversation between us.
Right.
And that's worked out extremely well. So at the very least, it forces us to be in contact. And for the majority of patients, we're in contact after the infusions. They call or email and we go back and forth. But for those that are not, we speak at the very short, at least 1 month after the infusions, and just touch base, reiterate. And we'll do that every month. So if they say, hey, I'm doing well, let's hold off on a booster infusion at this point, we put on for a month down the road. So the next month we have to talk. And it kind of goes like that. And that's really the most important thing to getting this to work. We've had patients that have gone through 6 infusions, never had to come back for another infusion. Just to get back to your original question, is this a one-time thing? The majority of patients do come back periodically for what I'd say is a booster infusion to maintain that level that we got to, that positive response, that improvement in functionality and quality of life.
Sure, absolutely. And I was also wondering, during these times right now, everybody's kind of pivoted and there's been a lot of changes. Is there anything new that you guys want to share about either side of the business?
There's a lot of overlap between the two services that we do provide. I would say that probably the most important thing to get out there is that patients who were sort of teetering before, everybody's got issues, most people living in today's society have issues with anxiety, or just day-to-day life is, certainly not easy to get through for the great majority of us. And patients who have a predisposition to depression and anxiety, this sort of the stress of the quarantine and isolation dramatically worsens things and accelerates them and exacerbates them. And I would say, please be aware that there is help available, whether it's making a phone call to us or anybody else, that we're aware that, the phone has been ringing off the hook because patients are struggling, and patients who were sort of getting by before just pushed them over the edge, and patients who were doing fine before have now come up against a real stressor and a real issue that's going to linger for years and years and years. And especially for younger people who, I have 2 teenage sons, and they're stressed with this. My older son was in college, and he's forced now to come home from New York, and he doesn't know even what the future holds. Is he going back? Is he not going back? So this has really uprooted a lot of lives. Nobody got away from this, unharmed. And just be aware that there are alternatives out there. There is help available. Please feel free to call us if you just want information, or you want options, or you just, you want to give yourself some. Did we lose you?
Oh, nope, I'm right here.
Okay.
I pulled up, as you're talking about contacting you, I've just pulled up your website.
Oh, okay. Gotcha. Sorry about that. So basically, the point I'm trying to make is that nobody got away scot-free from what's been going on with this coronavirus situation. And we're here if you have any questions or need help in any way.
Awesome. And I've got your phone number right here. Of course, I'll in the post, I'll put your guys' website, your address, of course, your phone number. but it looks like the best number is 941-242-7293. Is that right, gentlemen?
Sure. Let me give you another number as well.
Okay, perfect.
941-213-4444.
Okay, perfect. So feel free, everybody that's watching, thanks for tuning in. Feel free to jump onto their website and to just directly reach out to them with any questions. As you mentioned, Dr. Reichbach, right now, nobody kind of came out of this, unaffected or currently is not affected. So if you have that increase in anxiety or whatever it might be, please consider some of the services that are offered between, like you said, both kind of, it's like a perfect marriage of services you have there to really help people right now. So thanks, gentlemen, so much for being here and spending your time with us this morning to educate us on the medical marijuana side, the ketamine side. We appreciate everything you're doing right now.
Thank you for having us and letting us get this out.
Absolutely. All right. Well, everybody, thanks for tuning in. And this has been another SBB Live. And today we were with the Gulfcoast Ketamine Center. And please reach out to them to get some more information and have a wonderful day.